그동안 마스크 착용이 도움이 되지 않는다고 하던 캐나다 당국이 태도를 바꾸어 오늘 발표에서는 마스크 착용이 코로나19 확산 방지에 도움이 된다고 발표했습니다.
Since the COVID-19 outbreak began to accelerate in Canada, we know that many of you have questions, a lot of. As we've mentioned, lots of questions for you. And Dr. Bogosh, let's begin with you. And let's talk about face masks. Have the guidelines for civilians, ordinary people, using face masks changed?
No, they really haven't. We firmly believe that people in the general public should not really be wearing face masks because it doesn't really provide any additional protection against getting this infection. If someone's infected with the virus, it's very helpful that they wear a face mask to help prevent them from spreading it to other people, but they're not really going to prevent people from getting infected.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly.
We've all come to expect spin from our politicians, but we should hope we don't get it from our public health officials. And yet, Canadians are currently grappling with comments made by Dr. Theresa Tam at her Monday press conference. She was asked about the issue of face masks and whether or not the general public should be wearing them more. Dr. Tam said a few things on this topic. One of them was that the current scientific evidence says that masks do not help stop the spread among uninfected individuals. And then she did say, well, if the scientific evidence changes, they would be content with changing their guidelines. She went on to say that infected persons should be wearing masks, or close caregivers for them, and healthcare professionals as well. Well, what is it? Do masks work, or do they not? It seems like what's really going on here is that they are concerned that there's not enough masks for everybody in the country, so they want to make sure that healthcare professionals are not left rationing them or cut short. That is a very reasonable point to make, and I think the adults in this country could hear it and take that point. Okay, tell it to us straight. But to say that they don't work is a very odd comment to make, especially when there are more and more reports out that countries, particularly South Korea, have been well served by rolling out the mass use of masks among the general population. South Korea has done very good work at flattening the curve, and a lot of experts are studying what they have done to see whether or not this can be exported to other countries. The Washington Post reports that the Center for Disease Control in the United States was saying something very similar, and officially still does say the same thing as Dr. Tam, but officials speaking on condition of anonymity say yes, they're looking at revising this to encourage the mass use of face masks, whereby it seems if everybody is masked up, perhaps we can ease these restrictions a little bit more. To say travel restrictions don't work, face masks don't work, when a lot of Canadians are looking at the basic evidence and going, come on, we think there's a little bit more nuance to it. So please, just give it to us straight.
Wearing a non-medical mask, even if you have no symptoms, is an additional measure that you can take to protect others around you.
With the COVID-19 pandemic killing thousands across the globe, Canada's chief public health officer is changing course on prevention. Until now, wearing a non-medical face mask was not recommended, but new evidence has Theresa Tam pulling a 180.
In situations where physical distancing is difficult to maintain, such as in public transit or maybe at a grocery store, a non-medical mask can reduce the chance of your respiratory droplets coming into contact with others or land on surfaces.
Dr. Tam says the change from previous advice is due to increasing evidence that people with the virus can spread it without knowing they're sick. She says wearing a non-medical mask protects others more than it protects the person wearing it because it reduces the spread of respiratory droplets.
그동안 문화적 차이, 정서적 차이로 알게 모르게 동양인에 대한 인종차별적인 태도를 취했던 여러 가지 사례들이 있었습니다. 가장 근처에서 확인한 일을 한 가지 소개해드리면 그로서리 매장에서 스시를 만들어 파는 회사, 셰프가 한국인, 중국인이 대다수인 곳에서 셰프가 마스크를 쓰고 스시를 만들고 있으니 당장 중지하라고 그로서리 회사 본사에 전화해서 컴플레인을 하는 일이 많았답니다. 그 때문에 매장 책임자들과 스시를 만드는 사람들 간에 논쟁이 되었고 마스크를 착용을 못하게 하니 회사를 그만두겠다고 사표를 쓰는 일이 여러 번 있었답니다. 정말 어처구니 없는 일이 아무렇지도 않게 이렇게 벌어져 왔었는데 이제부터는 그런 일이 없을 것 같아요. 늦었지만 다행입니다.